Hello, everyone, and welcome back to the Outcomes Rocket podcast. I'm so thrilled to have everybody on the podcast today because we're going to be diving on a critical topic of ACOs and success stories, in particular, the engagement gap. What's missing in ACO success? We're going to explore why so many ACOs struggle to sustain patient engagement and how organizations like ThoroughCare and IRCCO are addressing these challenges. And joining me today, I've got some of the best experts in the country talking about it. I'm going to be speaking with Dr. Lauren Fore. She's the Chief Medical Officer at IRCCO. Todd Searls, who's the Executive Director and Representative from IRCCO ACO. And we also have Kathryn Anderton, Vice President of Clinical Services at ThoroughCare. Welcome to the podcast, everyone. I'm really excited that you could join us for today's discussion.
Thank you.
Happy to be here.
So look, before we get into it, I always love to just kind of help you tell a story about yourself. Is there anything that you want our listeners and viewers to know about yourself before we get into the questions? And why don't we just start with Todd?
You bet. So I came to accountable care organizations in 2018, working for a large vendor in the rural critical access hospital space, aggregator of all the critical access hospitals. So it's definitely been something that I've been involved with quite a bit and have seen everything from large academic medical centers to the smallest of the small rural succeed, and completely the opposite. I've seen the biggest fail and I've seen the smallest fail. So definitely an interesting space to have been in for the last 6-7 years.
Love it. Well, awesome background, Todd. Excited to dig in with you. Dr. Fore.
Yeah, so I'm a family practice physician and I've been working in critical access hospitals for my entire career. Then I've been able to get more involved with our ACO IRCCO over the last year as the CMO. So I still work in the clinical setting as a primary care physician, but now I'm also working with our ACO to help facilitate some of that provider engagement and buy-in, something I'm very passionate about, working to get our initiatives to our providers and then also getting a lot of feedback from our providers too and bringing it back to our ACO.
That's beautiful. Dr. Fore, thanks for joining. And people have these types of conversations without a physician in the room, and I think that's so wrong. So I'm so glad you're here with us. Kathryn?
I appreciate you saying that, Saul. My background is in nursing. I have experience kind of all across the healthcare landscape before landing in the care management space during the pandemic. And that's when you realize how helpful these care management programs are, especially between appointments and transitions. So my role at ThoroughCare and the role of my team is to really empower clinicians to establish how to do care management and incorporate that into their operations to improve patient outcomes.
That's awesome, Kathryn. Thanks for that background. And it is about partnerships in the end for success. And that's the topic. So let's get into it now that we've had a chance to get to know everyone's background a little bit more. The first question that I want to make sure we cover is, why do so many ACOs struggle to keep patients engaged long-term?
I would like to really dive back to our provider engagement. I think if we think about our ACO initiatives and even a lot of the metrics that CMS is putting out there, they are very much provider driven, whether that's the provider putting in a specific order or having a certain conversation with our patients or documenting something appropriately. We need our providers to really buy into these processes to help us then have those conversations with patients and to engage them. I've had different opportunities to talk with clinic administrators or even with schedulers. And sometimes they have difficulty having the patients buy into these different initiatives if they aren't using the provider's leverage. So if they're calling and saying, hey, you need this Medicare wellness visit, and they're like, yeah, I'm okay. But if we're having them call with a certain script saying, your provider, Dr. Fore, they want you to schedule this Medicare wellness, or I'm sitting and talking with the patient and I say, oh, I see you're due for your Medicare wellness. Let's get that scheduled. We're getting a lot more buy-in and engagement from our patients when our providers are also engaged.
Yeah. And I would
a really great point, Dr.
add
Fore.
to that, I mean, from the executive side, right? So it's also then very easy, I think, on the provider side to wonder if after a year or 2 or 3 of doing that, is this still a priority, right? So on the executive side of the fence, the C-suite, really needs to be proactive, I think. I mean, we lose a lot of patient engagement because we do in healthcare tend to put out there all of these burning fires. I mean, we know that there's going to be changes in Medicaid and things like that coming down. And so all those conversations happen at one time. And I really like to look to the executive suite to outline what are the priorities, right? How are we going to get paid under these value-based care programs that we're holding our providers, their care teams, and even the patients accountable for going and getting their mammograms and things like that. So I love it. If the providers are engaged with that sort of support, then they need to have a partner from the C-suite who then is willing to champion and also being willing to be proactive about identifying that providers are burned out, that every provider wants to take care of every patient that they've been assigned. I mean, I think that's just inherent in the providers who I work, Dr. Fore, especially, and all of her colleagues. But at the end of the day, are we really getting to 100% of those patients? And so we tend to lose engagement, I think, because the highest risk, highest priority patients may, bubble to the top like they should, but we can't lose sight of those who are starting to improve and perhaps fall down the call list just due to the number of staff we have, the hours in the day, the number of exam rooms. So again, I think the C-suite has a big hand in making sure that things are prioritized right, but then also ensuring that patients remain engaged in these programs through education of the care teams and everybody else.
Yeah, thank you, Todd.
I would also say I really appreciate that we're leading with the provider and the leadership buy-in, because oftentimes if that organization doesn't have that already established and clearly defined, then when it gets down to the care manager, they're not going to be able to really express that value to the patient with that kind of confidence to then have the patient want to opt in to do an elective program. We know it's beneficial, but that alone doesn't create patients that motivation for them to participate in the program. You really have to have that, their own personal buy-in. So I really loved hearing that we're going to strengthen that provider and then the leadership and then roll it out to the patients, because I think that's how you end up seeing positive results as well.
Yeah, so well said, Kathryn. And beyond humanly possible is a theme that we keep hearing, doing more with less. So don't worry, toward the end here, we're going to talk about digital tools, things that we could do there. So sit tight, because that is something that we will cover today. Rural communities, right? It's one of those areas that I think could benefit most from this type of work. What makes sustaining engagement uniquely hard in these areas, and how have you worked around it?
Yeah, I may jump in here and say that the biggest thing is that, especially when rural facilities join an accountable care organization, there's a lot of pressure, right? Because there's a lot of money that's on the table to get back to them, which they desperately need. And so there's an expectation out of the gate that they have to hit every goal immediately. But success in these sort of programs, especially when you're engaging a very rural community who has been very reactionary to their health in the past, right? I'm only going to come in after I'm, coughing up blood, right? Prior to that, I'm fine. But after that, all right, maybe I'll go to the doctor, sort of thing. Now we have this shift to proactive care. Those metrics are not going to hit 100% overnight. So I think the biggest thing in terms of sustaining care is that understand that every single care community is slightly different. We have some that are, I say, suburban rural. They've got access to staff because people want to live on an acreage outside of the big city in the country. We've got traditional rural, maybe around college towns, small college towns and things like that. But then we have the frontier rural who doesn't have the staff. They operate in the red or close to the red every single year. But that's where the breadbasket is, right? That's where the farming, our agriculture, ranching, and things like that are occurring. And they are the number one employer in the community, but it doesn't mean that that community is healthcare educated, right? So we have to, as times change, I think groups like ACOs have to take it upon themselves to be the educators of those staff and really get them trained and have them understand all the requirements that it takes to sustain these initiatives.
Yeah, for sure, Todd. It's a big need there. And partnerships are a theme. Can anybody comment around partnerships? I'd love to hear more on that.
Yeah, I mean, again, kind of jumping in on it, partners are great because, again, the extension of what we can't do in rural, we have to outsource. But it doesn't even have to be outside of the community. I think we talk about pharmacies, we talk about community health workers, we talk about third-party vendors who are able to come in and truly drive under value-based care, especially truly drive patients to get the care they need when they need it. But without partners to extend the reach of this, value-based care fails. I remember back in the day when I was director at a regional extension center, and even back then, we teamed up with pharmacies. What was it? God, I can't remember. Something up, pressure down, and team up, pressure down, I think it was, so that the clinics partnered with the pharmacists so the pharmacists could help deliver the education on blood pressure medication. And that's not going away. Blood pressure is still a huge thing. Hypertension, strokes is still huge. And without having that extender, as it were, into the clinic space, it's very difficult to drive any sort of outcomes, positive outcomes, I think.
I always think about that phrase of it takes a village. And obviously that's pertaining to child or raising children. But I think that goes to managing health. It takes a village. You need the provider. You need the pharmacist to then stop and provide that medication education. You need a care management team or remote patient monitoring. You need all of these tools to really help the patient be successful. It does take a village. It's hard.
Yeah. And honestly, our vendors and our partners, they are experts in their own domain. So I can read 3,000 pages of federal legislation and call myself an expert every single year in terms of the regulatory response, but I'm not an expert in the new tech that perhaps Medicare age patients are able to use and want to use, right? It's convenient for them and the messaging to make that work. So a lot of times you are really trusting those partners to be an extended expert and educator for our clinical teams.
Yeah, thanks for that. And Dr. Fore, I think you were going to mention something there.
I was just going to say one person can't do all of those things. And so like Kathryn mentioned, that's good collaborative care. Like that's good patient care when everyone is working together with their different expertise and to help take care of the whole person. So I think you have to have those resources where everyone's working together. People deserve that.
Totally. That continuity with the village, all these important touch points. And so ThoroughCare, Kathryn, you guys emphasize monthly touch points. What makes these check-ins meaningful instead of just another task that physicians have to do?
This is such a great question because I think so often clinicians, especially care managers or nurses from a hospital setting, you're used to this work list that you check this off to the next, check this. And I think what's most important about these monthly touch points is relationship building. For any change to occur, you need to feel right about it. It needs to feel good. So when you can use those opportunities to engage with the patient, have a conversation about their dog and, what's happening in the neighborhood, because all of those things are what's going to make the patient answer your call the next month and want to continue to build that rapport and change those behaviors we're wanting to see. So I think it's so important for clinicians to practice things like motivational interviewing, how to conversate, go back to that bedside nursing days where you need to have that rapport. The outcomes will end up speaking for themselves with that.
That's great. Yeah, I really appreciate that, Kathryn. It is people. And it gets so busy. We get so task-oriented that we're just we have to force ourselves to get out of that and really make it a point to connect. And, the thing that I find really interesting is the work that IRCCO has done around this shared learning network. You guys have been very intentional about this. I'd love if you guys could share one engagement practice that you've seen spread successfully across all your members.
I think anytime that you can engage with your community as a healthcare institution, it's very successful. So whether it's in person at, say, a health fair, or even a community of the celebrations that occur, the 50th, anniversary of the founding of the town, or the 150th, or things like that, where there's a presence to remind people that we're community members too. We want the best care for ourselves, for our kids, for our grandparents, parents who live in the same town. And I think taking that to the next level, right? The modern time, even though it's been around now for dozens of years, is the internet and social media, right? We have providers who are going onto Facebook and talking about the importance of annual wellness visits. And in small towns, Facebook's still very big, right? I know that the TikTok generation and younger and things like that. And I have a 15-year-old. He asked Mindy and I, my wife and I, not that long ago, like, why do you guys use Facebook? I mean, it's like, well, because we were the OG, we're the original, we used it, right? And I think that it
Yeah.
speaks to the generations of technology and things. But if that's where the population that you're trying to reach lives, then I think our members are doing a good job in meeting them where they live, both in person and then also virtually, where they go and they share their stories and the pictures about their kids and things like that, or where they talk about I mean, it's amazing. We do have HIPAA, but it's amazing to me how many times and how much we're very free when we talk with friends and family about the healthcare crises that are going on inside of our families. And if you're in that platform and you just happen to see somebody said something about breast cancer awareness from the local hospital, then you're going to probably click on it and you're going to look at the videos that they posted and the documents. So I think that's one of the key success of our members in rural America is making sure the community knows that we are members of the community and that we'll meet you where you are in order to get the message across and try to make it as convenient as possible for you to get in and see us.
Yeah, Todd, I'm glad you went there. I feel like this in particular, the use of social media tends to be one of those topics that maybe some folks aren't as comfortable with. And this idea of HIPAA and the responsibility around privacy, there's actually examples out there today. I mean, you guys are a great example of it, but there's others like Dr. Kevin Fore, for example. He's done a fantastic job as a physician of showing that it's a great idea to connect on social media. And there's other examples out there. Don't let uncertainty stop you, because it really is a great way to connect. Look at IRCCO as an example. They're available to share with you best practices. And Dr. Fore would be open to hearing from you as a physician on this topic. And then we could get into digital tools and nudges. What do you think about social media and the use of it to engage with communities?
Well, I think like Todd mentioned, meeting people where they are, they're on social media. I mean, that's where they're getting a bulk of their information these days. So I think we need to be present there. They deserve to get factual information from a trusted source. And why can't that be their local healthcare organization? So I think there's definitely a place for us to be there. And I think the patients kind of need us to be there too.
I think that's great. When we talk as a family, right? My son, of course, is 15. He's at the age where he Googles things. Well, why doesn't the answer come from the local hospital as opposed to some anonymous website somewhere with a testimonial on something that may or may not be verified? So I think that's so important what you said, Dr. Fore.
Yeah, I love it. I'm very passionate on this topic, by the way, guys, if you haven't noticed. There's definitely a lot of people putting information out there. Like you said, Todd, like people selling green powder, like green drinks, giving information that our kids that we are looking at because it's available. Like the opportunity is up to us in the healthcare seat, the experts, to put the information out there, make it available for people to access it. So love it. Glad we're having this conversation. And Dr. Fore, around digital tools, nudges, all these things make a difference in really maintaining that personal human connection. Can you share more about this and ways we could think about it?
Sure. I think there's definitely a place for digital tools and digital nudges for both providers and for patients. So for me as a provider in preparing to see a patient, a lot of times I'm doing a lot of like data extraction, pulling things out of charts and digging around in there. But if there's a digital tool or my EMR, if it could work for me and give me those digital tools and nudges to facilitate some of those conversations without me having to put in all that legwork, I mean, I'm all for that. And then as far as for patients, I wouldn't want it to take the place of that human connection and those conversations that we're having face to face. But I mean, I think we can all agree that we need a reminder sometimes to do things, especially things like we don't want to do. So I think there's a place for that. When I see a patient, maybe like their mammogram was due last month or something, we'll have a conversation. So we'll get it ordered and they'll get it done. But what if that appointment wasn't for 6 months down the road? Now it's almost a delay in care. And that's where I think the digital tools and nudges can be really useful, is helping to facilitate that patient's care in between those human interactions, those human face-to-face appointments.
Yeah, thanks, Dr. Fore. And, from a ThoroughCare side, Kathryn, flexibility is key, right? Talk to us about omni-channel, is there a play there? What are you guys seeing on that front?
Absolutely. I think I'm so grateful, Dr. Fore, you're reading my mind that, yeah, we can't replace one for the other. This is two necessary things because maybe one time you're talking with the patient, providing that education face to face, but then you have to reiterate that information to her daughter, who's the primary caregiver, and she's got a full-time job. So you should just send her a text. There's a lot of different ways that we can use these digital tools to work for us. One, having integration, so it is available, readily available, because you can't be jumping between several different systems as you're also trying to have a conversation with the patient. So that's where having technology work for you, I believe was what was said, is I think best practice too. And then realizing that nurses, care managers are great at triaging in life. So some things we can have more of a hands-off approach, but knowing when to have that face-to-face or phone-to-phone interaction is so important. You can never replace that in my experience.
Thanks for that, Kathryn. Todd, let's get back to you on this next one.
Sure.
How has care management software like ThoroughCare, for example, helped roll out programs and overcome tech hurdles?
Well, I can tell you, no hospital, be they rural or otherwise, wants to manage a new app on a patient's phone themselves. So having a partner who understands not only the technology, but that is part of their service, is to troubleshoot that, to get connected with them, make sure that they can ask questions back and forth. And you've got almost that extra line of support. So from the tech hurdle side of things, I used to be an IT director. The first thing I want to know, is this going to be put on my staff to support the communication means, the apps today, or is that something that my partner is going to help with? So I think partners who do that, like ThoroughCare, who have a whole care management suite around them in which they call in and they talk to the patient, they document it, they may send them reminders if they're using some sort of chat app or things like that. That is so important to have, because then I, as the executive director or as a CEO in a hospital, I don't have to follow up on that. I know it's being done because they're our partner and they're taking care of it. I also think that it's not just the technological hurdle, it's really the education hurdle. In terms of, if I'm partnering with a vendor for my rural facilities, one of the biggest things that I want to be sure of is that that vendor partner of mine is a subject matter expert, like I alluded to earlier, and that the care managers, as Kathryn, you had mentioned, right, the motivational interviewing, trying to get to the why behind patients have failed to meet their healthcare goals in the past, being able to have those conversations. Sometimes staff in rural areas just haven't received that training, and it's a lot of triage, treating, reactionary care. So I truly believe that the vendors truly are trusted partners when it comes to delivering that. And then I would say lastly, right, unifying all the conversations, ensuring that's what's happening on the vendor partner side is flowing in some way, shape, or form into the practice, right? The one thing that providers are absolutely correct in wanting to ensure never happens, in my opinion, is that they lose track of all of the care that's occurring outside of the four walls of their clinic. They want a true partner who's going to report back in. Kathryn, as you said, right, they're talking to the patients about their dogs, their family, but then suddenly they hear that, they just lost their sister, they just lost their brother-in-law, their daughter's going through healthcare crisis. Well, is this now a person who's going into depression because life has become so overwhelming? And they will then flag it for the clinic staff. And so I truly think that all of that extra attention that's being paid to the patient is a benefit if that partner can, again, support you on both the technical side, the follow-up side, the documentation piece. All of that makes implementing a solution like this just so much easier. You basically sign on the bottom line, you true up the patient lists of the patients who need to be seen. And that a lot of times is partnership as well, in terms of what's best practice, what have other groups done, care cohorts, things like that, that small practices who are inexperienced in these value-based care programs may not know who to prioritize. And so I do think that again, it takes a village, all that good stuff. And as Dr. Fore said, there's just no way one person or one pod or one team can do everything that needs to be done to deliver exceptional healthcare So, yeah, I definitely think care management vendors have stepped into a very big need, especially in rural America, where there just isn't enough people and they can't afford the technology if they wanted to implement it themselves outright.
Well said, Todd. And it gets complicated, right? There's chronic care management, there's transitional care, there's RPM, there's mental health. So there's so many programs. Why encourage multi-program adoption across providers beyond just CCM? Would love to hear from Dr. Fore on that one.
Sure. I think it just comes again down to patient-centered care. So we're doing what our patients need and we're approaching them each as an individual person and kind of adjusting what kind of programs that would benefit that person the most. So I think, again, back to like the collaboration between the different groups within your organization, working together to help take the best care of those patients.
I always look at it almost as these programs all serve a purpose. You have a tool available, and considering holistic patient care, we can use a tool for each aspect of this. So you can have chronic care management where you're focusing on that education component so that they understand how to manage their conditions effectively. You have RPM to make sure the interventions you're delivering are actually landing and impacting that care. And then you have transitional care management, because even when you do all of the things right, sometimes they still go to the hospital. So we want to make sure patients have that support. And then behavioral health, BHI, because change is hard. That's a behavior change, and you want to check in and make sure people can handle that appropriately and are able to navigate the challenges that come with that. So when you can leverage these programs, I think it really does create this whole big patient picture that really enables the care team to effectively manage patient care.
I'm glad you both started, because then I have to put on my executive director finance hat, right? That says at the end of the day, it's all about the money. And if you're only focused on one thing, just like Kathryn, you mentioned, right? Transitional care may be missed, right? Because you discharged a patient to a skilled nursing facility, but a lot of times those skilled nursing facilities aren't going to call you back when that patient gets discharged to the home or anything else, and you don't even know it. And then suddenly an issue happens because what they were discharged with from that care facility was bad advice or no advice or something else. And so having someone there who can follow up and recommend the appropriateness of care, right? Chronic care management, where we call patients monthly, doesn't have to be right forever. It's the idea is that you're checking in with them after an episode, say sepsis. And we know that after a septic episode, fortunately, if the patient survives, they're still probably going to have some unfortunate healthcare issues to deal with. And we get them through that, and then you graduate them from that. But that doesn't mean you're done, because you may want to take them down from chronic care management to the remote patient monitoring for one condition. And so the billing changes on the back end. But if all you're doing is putting one tool in your toolkit, then you're missing out on a ton of good healthcare for the patient. But in my experience, also, you're missing out on revenue, in-year revenue for your clinics. And you're also missing out on maximizing the shared savings, because it's probably going to lead to a downstream readmission, a new hospitalization, a visit to a specialist instead of the PCP. So to me, that whole suite of care management has to be, if your team can't deliver it, then they need a partner who can help you step in and do that. Otherwise, again, you're leaving money on the table and the patient's just not getting the care that they need.
Yeah, thank you guys. That's really great to hear the different perspectives on that from Dr. Fore's listen, understand, and deliver that care that the patient needs most, to the full program picture that Kathryn offered up. And then finally, threading the needle through all of the necessary financials to make sure it all makes sense is definitely critical for success. Look, I think we're going to have to do a part 2 on this, guys, because this is so juicy. But if we wanted to leave our listeners, our viewers with final advice, what would you tell them? These ACOs wanting to close this engagement gap, what would you leave them with?
I could start. So I'm going to fall back on our provider engagement. I'm very passionate about engaging our providers, whether that's within their own organizations or within our ACOs. But I think if we take the time to really educate our providers on what our ACOs are, what they're doing, and then the why behind that, I think that will carry over to our patients. Our providers are talking to patients every day, And we will see them start to facilitate some of those conversations. And then we'll get more patient engagement too.
So I think you can't say that you've always done it this way before, right? You have to be willing to change your processes. And that's very difficult. I think it's very difficult for providers who have been there for 30 years, the same way it's difficult for executives who have been managing their hospitals for 30 years. Value-based care is a new paradigm. And so if out of the gate, the very first thing I think you should be thinking about is kind of doing an organizational assessment of attitudes towards change and really figuring out where you're going to need more support to get people to move in this new direction. And I think that goes back to what Dr. Fore said, which is communication. You have to sit down and explain this to everybody, that you're not doing it just to check a box, just to avoid a financial penalty. This is truly better care for the patients, but it may come with some pain while you work through those things. But here's what I'm going to do as an executive to support those pain points. If you fail to have that conversation before you even begin, you're 10 steps behind your peers who did have that conversation.
Thank you, Todd. Yesterday's tools won't serve us tomorrow. Love that. Kathryn?
Yeah, I think for me, one piece of advice I would give to ACOs to close this engagement gap is to really invest in the care managers and their ability to communicate. That soft skill of motivational interviewing really goes a long way to strengthen that engagement long term and to have patients coming back for other things too. And so I see a lot of patients fall off of the care management program because that engagement wasn't there. They're not feeling super cared for or understood, or maybe they're feeling like they're being talked to or talked at. So I would really, really strengthen that motivational interviewing skill.
I love it. Well, thank you, Kathryn. Really appreciate you closing us off and everybody kind of leaving us with your ideas and recommendations on how to increase success. And with this gap, right? This engagement gap could be closed. It's going to take more than tools. There's nudges, there's strategy, but ultimately, I think what you guys shared today will help us get closer to that. If folks want to reach out to you and learn more about your organization, what's the best place to do that? And give me the best place for your business. I'll make sure to link up everybody's LinkedIn's if that's okay, if folks have questions. But where can they visit you on the web, guys?
So IRCCO is the letter I, ruralhealth.org. And that's really our footprint on the web there. But I think also, like most people, right, many of us are on LinkedIn. So professionally, that's also a good way to reach out to me if you're a professional in this space and you're thinking about starting an ACO or joining one, especially if you're a rural provider. Again, it is so great to network with your peers and talk about what you think your strengths are, what your weaknesses are, and then try to group think ways around that based on your unique situation. So I would say those are probably the two best places to find me.
Awesome. Dr. Fore?
The same. So I have the same website as Todd. Also on LinkedIn, that would be absolutely fine to reach out to me that way.
Brilliant. And Kathryn?
If anyone has any more interest in learning anything about ThoroughCare, the care management platform, they can go to www.thoroughcare.net for more information.
Beautiful. Well, I want to thank all of you for joining me on today's session. I think we're all in a lot better place after listening to the insights that Todd, Dr. Fore, and Kathryn shared with us. Thank y'all for tuning in. Be ready for a part 2, maybe, if we could chat about that next time, because this was a really good one with more to unpack. But Todd, Dr. Fore, Kathryn, thank you so much for joining us.
Thank you.
Thank you.